Hello, welcome, welcome. For those of you who are just joining, feel free to scan the QR code if you can see it on the screen and just select what field you're in. Hello, welcome. Okay. We will just wait for a couple more minutes and start at, is it 8:07?
I like the background change. Very nice.
Thank you.
Really matching the theme here. Okay. Andrea, should we get started?
Yeah, for sure. Welcome everyone. Thank you so much for being here on a Monday night. Really appreciate your time. And thanks for those who have gotten involved with the Slido poll. It's really cool already to see kind of the diverse range of folks that we have attending tonight's event. I'll just start by introducing myself. My name is Andrea, and I am a third-year medical student at UBC and the UBC chapter lead for the Canadian Social Prescribing Student Collective. And I'm so happy to be here tonight co-hosting with Trinity Western for this wonderful event. Jeffrey, would you like to introduce yourself as well?
Yeah, thank you, Andrea. Hi, everyone. My name is Jeffrey Wong. I am the Trinity Western University chapter lead at the Canadian Social Prescribing Student Collective, and I am a third-year undergraduate sociology student. Um, so just wanted to give a brief overview for everyone who has never heard of CSPSC before. We are the Canadian Social Prescribing Student Collective. We have uh, 4 national working groups. We are all student-led. We have a medicine working group. We have a knowledge translation and research working group. We have a policy working group, and we also have a practice working group. In addition to that, we have chapters from all over the country at different universities and colleges. So it's great that we have our 2 BC chapters here together tonight. And yeah, if you're just joining now, feel free to scan the QR code or just go to slido.com and type in the 7-digit code to just pick what your field of study is. Looks like medicine is winning.
Okay, and we have a very special guest here with us tonight. We have Laura Hergott, and I will hand it over to you, Laura, if you'd like to introduce yourself and talk a little bit about your role and what you're going to teach us about tonight.
Sure. I mean, can I just maybe get started and it'll all come to light, or yeah? Okay, I'm gonna share my screen then. Okay. Now we did try this earlier, but maybe a quick thumbs up just to make sure that y'all are seeing a full screen PowerPoint slide. Great, thank you. So thank you so much, Andrea. My name is Laura Hergott, and I'm really excited to be here on behalf of the BC PaRx Foundation to talk all about our National Nature Prescription Program, PaRx Prescriptions, or how I often refer to it, and will be referring to it throughout this presentation as PaRx. I like to spell it out because when you say PaRx out loud, it doesn't really do it justice. And again, thank you to the organizers for having me here tonight, and for all of you for taking time out of your evening to be here. I really appreciate it. I love sharing this work. So as a geneticist by training, I was really drawn to the program by all the science backing the initiative, that intuitive feeling that I had that being in nature was good for me. I was living in downtown Toronto for a few years and found that living in the city and being further away from nature really took a toll on my mental health. So to remedy this, I moved to North Vancouver, where I now live, surrounded by big old trees at the base of a mountain. And I've now made it my mission to help share this nature health message with everyone I can. And I do this every day as coordinator of the PaRx program. So in the next half hour or so, I'm going to briefly touch on the global nature health movement, the science behind the health benefits of nature, the side effects of spending time in nature for both planetary health and the economy. And I'm, of course, going to talk all about the PaRx program and how you can support the nature health movement. So traditional Indigenous ways of knowing, which include natural or first laws that view human and ecosystem health as deeply interconnected, have recognized the importance of connecting to the land since time immemorial. Terry Tegee, Regional Chief of the British Columbia Assembly of First Nations and BC PaRx Foundation board member, summarizes this as, if we take care of the land, it will take care of us. And so at the BC PaRx Foundation, we are all about connecting people to nature, and we do this in a variety of ways. Research shows that using the health lens is one of the most effective ways to build support for conservation, more than the doom and gloom tactic or talking about wildlife that some people may never feel personally connected to. And so one way that we encourage people to connect to nature for their health is through nature prescriptions. This is a formalized recommendation coming from a healthcare provider to spend more time in nature for health. And we are not the only ones doing this. So connecting to nature for health pops up all over the world in many different forms. From the modern practice of Shinrin-yoku, or what's known as forest bathing in Japan, to PaRx in the United States, the first national nature prescription program. And this is just a handful of programs. There are many more, but I didn't want to overwhelm the slide showing them all. And all of these programs are based on this growing body of evidence that show that spending time in nature fights depression and inspires confidence. It reduces the risk of heart disease and stroke. It improves immune function, respiratory function, sharpens the mind, lowers the risk of asthma and allergies, and even helps you live longer. There are a huge range of health benefits about spending time in and around nature. And I could spend a whole hour just listing every positive health outcome, but instead, I'm going to keep it concise, and I'm going to spend more time talking about what I find is more interesting, which is the why, or the how. So scientists have been theorizing the mechanisms behind all these benefits for decades. And there are three prevailing psychological theories that I'll mention. The first is called biophilia. This is based on our evolutionary history of being in nature and directly translates to love of living things. That basically, since humans evolved around nature, not in concrete cities like we do now, we like it and it feels good. And so I do just want to do a quick exercise here. I want us all to take just 30 seconds, maybe close your eyes if you'd like, and I want you to think about how you feel when you spend time in nature. Maybe think about a walk you went on recently, or a beautiful sunset you saw, or the sounds of waves on a beach, maybe seeing a really cool mushroom. And if you can sum up that experience in only one word, what word would you use? And I'll pause here for about 30 seconds, and I'd love for us to all put one word in the chat. Okay. So I've got energy, serene, calm, peace, in awe, grounded, wonder, peaceful, tranquil, serene, peaceful. I love all that. Thank you. So I've done this exercise with a variety of groups: doctors, teachers, kids, camp counselors, park operators. And what's really interesting is that a lot of the same words come up no matter who the audience is that I'm speaking to. A lot of the words came up in the chat today. Other words I see a lot are grounded, re-energized, alive, connected, happy. And what's so great about nature and so great about what I get to do every day is that it just intuitively feels good to be in it. Okay, let's get back to the other whys. So another theory is called attention restoration theory, or you might hear it being said as ART. So this theory states that our ability to concentrate is restored by exposure to natural environments, which we find intrinsically interesting. So when we're at work or we're at school, we're often forcing our attention on something and ignoring distractions around us. And this is exhausting. And that type of attention, what might be called voluntary attention, is finite and it gets fatigued. But by engaging our involuntary attention in something that's intrinsically interesting, it refreshes that voluntary attention. allowing us to direct our focus again on that difficult task. A small pilot study done in Chicago tested this theory in kids with ADHD. The researchers guided a group of these kids through 3 different 20-minute walks through 3 different areas: a city park, a downtown area, and a residential area. And they found that after only 20 minutes in the park, the kids improved their digit span backwards score, which is a measure of verbal working memory and commonly used in kids with ADHD. It brought it back down similar to levels in kids without ADHD, or up to, sorry. Whereas the walk in the neighborhood or downtown didn't have that big an effect. And this is a great study because it separates out the effects of exercise, which we know is good for us and we know is good for our brain and for our health. But when they pulled that out, they found that the park walk even rivaled the peak effects of prescription stimulant medication like Ritalin at improving this DSP score. Now, no one is saying that a 20-minute walk in a park is going to do everything prescription medication can, but this speaks to how powerful nature time can be to an adjunct to what's normally prescribed in the office. And the third psychological theory is called stress reduction theory. And it simply states that natural elements promote recovery from stress. This is a study from 2019 that took 36 city dwellers and asked them to have a nature experience in an outdoor space of their choosing that brought them a sense of contact with nature at least 3 times a week and for 10 minutes or more. And I really like this study because they in fact told them that they can self-define what their nature experience is. If they felt like they'd had a meaningful experience, they record it, check their cortisol, and then they'll take the data. They didn't say you have to meditate in nature or hug a tree, or you have to be in a provincial park or a certain distance away from a road, just any meaningful connection. And what they found is that their cortisol or stress hormone levels were 20% lower after a nature experience compared to a non-nature experience. And the efficiency of this drop of cortisol was greatest between 20 to 30 minutes. That's that lowest red line in the regression graph. 20 to 30 minutes. Now, for me, the effect nature has on my stress is definitely something I take advantage of most often. I can get in one of those moods where, I'm feeling a bit more apathetic, kind of in a rut with day-to-day stuff. And a quick trip connecting to nature always helps me feel like myself again. Now, beyond the psychological theories, there are a few other proposed mechanisms as to why nature is good for us. These include the biophysical changes to the environment, like cleaner, cooler air, softer ground, even the smell of trees. So trees produce these volatile organic compounds called phytoncides, and I've put a molecular structure of one on the screen. And they produce these phytoncides, trees produce these phytoncides to ward off insects and other pests. And it's that lovely forest smell you get after a fresh rain or on a crisp fall day. And these phytoncides, chemicals produced by trees, have been shown to specifically boost human immune function as well. A study housed people in hotel rooms for a few days, and some had phytoncides diffused into the air and others didn't. And that was it. Absolutely nothing else. No other nature, no softer ground, no cleaner, cooler air, just breathing in the smell of trees. And those that were breathing in the phytoncides had a boosted immune system compared to the other people, and this effect lasted for several days after the exposure. There's also 2 other really important side effects of nature time. People who spend more time in nature are also significantly more likely to meet physical activity guidelines and to be more socially connected to their community, therefore improving our health in more ways than one. Think about it. When there's something intrinsically interesting in nature, you're moving from one side of the trail to the other. You might be inspired to hop up on a log and balance beam your way across, or take a few extra minutes and really steep steps to get to that optional lookout point. Or if you're having a good time chatting with a friend, you say, you know what? Let's do another lap around the pond. And even if you're in nature by yourself, you feel more connected to the community, to all the other folks whose muddy footprints you're following in the trail. At the BC Parks Foundation, we like to think of nature as the 4th pillar of health. just as important as good nutrition, exercise, and sleep, the other three universally recognized pillars of health that our health system has emphasized for decades. But nature is the fourth. Okay, so I've talked a lot about us, humans, me, and what nature can do for us. But I want to shift and talk about how nature prescriptions and spending time in nature for health can be good for the planet. So firstly, if the global healthcare sector were a country, it would be the 5th largest greenhouse gas emitter in the world. So improving people's health status with more nature time can have a big impact on reducing healthcare's climate footprint. More people valuing time outside for health also means more active transportation, like walking and cycling, helping reduce air pollution and carbon emissions. Research also shows that children who have more nature experiences growing up are more likely to become adult environmentalists, and adults who are more connected to nature are more likely to protect it. And in addition to protecting the nature we have left, this also includes advocating for more green space in our cities. And urban greening has a multitude of benefits, includes improving water quality, filtering out pollutants, mitigating climate change, and increasing biodiversity. This map on the screen shows the surface temperature of Metro Vancouver. The blue areas are highly forested, while the red lacks tree canopy. The difference in temperature can be up to 19 degrees Celsius. Tree canopy and no tree canopy. You'll also notice that the red areas are in some of the city's most underserved communities, which is no coincidence. In our changing climate, and as we see more extreme weather events like heat domes, urban greening can literally save lives. Now, I like to talk about the 330-300 rule, which comes from Dr. Cecil Kononendijk, who's done some incredible research about the health benefits of a 30% tree canopy. And this rule helps us define when a city is healthy from a green perspective. The rule states that every single person should be able to see 3 trees from their window. Each neighborhood should have 30% tree cover, and everyone should be 300 meters walking distance from a high quality green space. And cities around the world are starting to adopt this rule and doing their part to meet it. Obviously, Vancouver has a little bit of a ways to go. But a really important aspect of this rule is that doesn't mean 30% tree cover in only certain neighborhoods or one really big park with 300 trees. It means every single person in every single house in every single neighborhood. Now, another often unexpected side effect to spending time in nature for our health is to the economy. In the US, considering the health benefits of increased physical activity alone, parks contribute an estimated annual value of $33.5 billion. And worldwide, an Australian study found that access to protected green spaces provides an estimated annual savings of $8 trillion in mental health costs. Mental health costs alone. Can you imagine the value of spending time in nature across all health outcomes? And we won't just be saving healthcare costs because people are healthier, we're also boosting economic productivity. This is a great argument to use when you come up against some naysayers of urban greening and the value of parks and protected areas. Our parks and trails are a valuable community asset, and we should all prioritize investing in them. Okay. I've talked all about how connecting people to nature for their health has a multitude of benefits, both for humans and the planet. So let's dive into nature prescriptions and PaRx, which the BC Parks Foundation launched in November 2020. It started with just a handful of healthcare providers here in British Columbia, and now it's in every province across the country, and thousands of people are prescribing nature every day. So you might first ask, why a prescription? Why not just a clever marketing campaign? And it's because people are more likely to change their behavior when it comes from a healthcare professional, and they're more likely to follow through with it when it's physically written down, when it's something specific, tangible, and it can be measured. We hear from our patients all the time that they'll put their prescription on the back of their front door or on their fridge as a daily reminder to get outside. One of our patients, Jillian from Manitoba, said, "Getting a prescription for nature from a medical professional made me think more seriously about it, and I made a point to get outside whenever possible." Like any medication, we recommend a specific dose, starting at 2 hours a week, 20 plus minutes at a time, based on studies that show that this is the best bang for your buck. And we also emphasize in our program that any personally meaningful connection spent in or around nature counts towards your prescription. Even having indoor plants, listening to bird sounds on a playlist, or having nature as your desktop screensaver can improve your mood. I'm serious. This is an example of a real PaRx prescription given to a patient, Alicia. She's a 43-year-old woman who presented with anxiety to her pharmacist. She has trouble focusing at work, especially in the afternoon, and has a hard time falling asleep. During her lunch breaks, she doom scrolls in the staff room. So her pharmacist wrote her this prescription for 2 hours a week, 20 plus minutes at a time. It suggests that she spend her lunch break outside going for a walk, or even sitting on a park bench. She's also told to take work calls outside instead of in the office when she can, and before bed, to take a short walk in the evening. These steps will help reduce her anxiety, they'll improve her focus, and help her get better sleep. It seems simple, right? That's because it's meant to be. We advise people to make small green tweaks in their life, swapping out indoor activities for outdoor ones, and accessing whatever nature is close to them. You don't need to hike a mountain to connect to the outdoors. PaRx tries to make it as simple as possible for healthcare providers to prescribe nature and for patients to be successful in building their new nature habit. For example, we have 14 of these patient fact sheets here on the right, themed on a variety of health outcomes that healthcare providers can print out for their patients or send as a PDF, whatever works for them. It gives little bite-sized pieces of information and tips for success. We also talk a lot about these 5 tips for prescribing nature, many of which were used in writing Alicia's prescription. So first, making an achievable weekly nature time goal, which we recommend starting as 2 hours of nature a week, at least 20 minutes at a time, but this goal can of course be customized to the individual. If this is far outside someone's reach, start with 1 hour and work your way up. Or if someone's already spending 4+ hours, increase the goal. And importantly, the more meaningful the connection is, the better. Realistically, you could watch Netflix outside and you'd still be getting some health benefits. But unplugging from technology and tuning into nature is going to boost those benefits tenfold. Then it comes to the actual plan in tips 2 and 3. This is where we encourage healthcare providers to use motivational interviewing to find out exactly what the right plan for their patient is going to be. My nature prescription might include walking my dog through the forest trail near my house every morning, taking my coffee break on my porch, and then a hike with my friends on Saturday mornings. But someone else's prescription might look like journaling under a tree twice a week, watching sunset on Wednesdays with their family, and gardening on Sundays. And what you'll notice about these prescriptions is that there's always a who, a what, a when, and a where. You're more likely to actually do something when it's written into your schedule, and further when you involve someone else. People play this trick on themselves all the time, just like going to the gym. If you promise to meet a friend at the gym Tuesdays at 5 p.m., you're a lot more likely to actually go than if you're not meeting a friend and if you didn't actually schedule it for 5 p.m. You'll also notice there's really nothing too impressive about our prescriptions. We didn't say run a marathon or learn how to scuba dive. These are activities we already liked doing or slight modifications on what we were already doing. Remember the green tweaks I mentioned? They're the easiest way to add more nature into our day-to-day routine, like for my prescription. I mentioned taking my coffee break on my porch. Normally I do this inside on my couch, looking at my phone. Now I do it outside. Okay, back to the tips. So tip number 4 is to follow it up, to check in on your patient's progress the next appointment after you prescribe it, recognize and reduce barriers, and tweak the action plan. Finally, to be the change yourself. Patients who see and hear evidence about their healthcare providers putting their nature recommendations into action are more motivated to change their own behaviors. Every year on PaRx Day, which is the 3rd Sunday in July, we encourage healthcare providers registered in our program to organize a walk in their community. It could be with their family, their office staff, or even with their patients. Change starts with just one person. And if you're still confused about how nature prescriptions would fit into your practice, we like to relate it to the other 3 pillars of health, as mentioned earlier. And so whenever you're doing counseling about eating healthy, getting exercise, or getting good sleep, spending time in nature should be that 4th recommendation. Okay, so I've got a second case study here. This one's a little bit different. It's for Janice, and we're going to write this one together. So Janice is an 81-year-old retired teacher. Her past medical history includes Alzheimer's, dementia, osteoarthritis, hypertension, and she's wheelchair bound. Following an extended post-op stay after a hemicolectomy, she was discharged back to her nursing home. The nurse in charge reports that she's been waking more often at night, confused, and she's more agitated during the day. She gets daily visits from her son in the evening, and they watch TV together in her room and chat. So if Janice came to you with, and this was the case that was presented, what recommendations would you put on her nature prescription? And I'd love to see some ideas in the chat. We're probably not going to recommend she take up mountain biking. So Allie says daily walks with her son. Perfect. Keep her accountable.
Yeah, maybe because she's like wheelchair bound, maybe when her son comes to visit, he could even just like take her outside and they could do like chat outside or do like a puzzle outside, whatever. But just being outside.
100%. We also have a weekend outing to a local park. Love that. I bet that would, she'd look forward to it all week. So you really nailed it. We recommend that Janice was encouraged, we encouraged the son to use the visit time to go for short walks outside, which was recommended, or to even sit on a bench outside at the nursing home property. And then I like the weekend outing to the local park, which we don't have in her prescription. But what we also have is that if the weather's too cold, to sit near a window or put nature shows on the television. We hear this quite a bit from healthcare providers who work a lot with inpatients who can't leave the hospital. How can we add more nature? Exactly. It was also just put into the chat, to be near a window to observe nature. That's a great way to enjoy it. Put a bird feeder near her window. So entertaining. So Alicia was issued her prescription from her pharmacist, and Janice was issued hers by her nurse. And that's because not everyone in Canada has access to a family doctor. And because the health benefits of nature are so varied, any regulated health professional in Canada can prescribe nature with our program, including social workers, nurses, physiotherapists, even optometrists. My sister-in-law is an optometrist, and she prescribes nature all the time. Studies have found that just 1 hour per day of nature can reduce the risk of myopia in kids by 45%. 45%. Now, all time, more than 15,000 healthcare providers have incorporated nature prescriptions into their work, and this includes more than 7% of Canadian doctors. You can see in this map here, these 15,000 prescribers come from all across the country. Our program's been endorsed by more than 100 Canadian health and parks organizations, including the Canadian Medical Association. This is the first National Physicians Association in the world to formally endorse a nature prescription program and write it into policy. In 2022, they wrote that every practicing physician should incorporate nature prescribing into their practice, and every medical student should learn about it in school. Since 2020, it's estimated that more than 1 million nature prescriptions have been issued to Canadians. 1 million. Now, although Canada is known for its beautiful wild nature, entry fees and lack of transportation can be a big barrier for people trying to fill their prescription. So to ensure that everyone in Canada has access to nature, we work with our generous partners to reduce these barriers. For example, we've partnered with PaRx Canada to provide free annual discovery passes so patients can access national parks free for a year, those who otherwise can't afford it. And we've had great results with these programs. Sometimes visiting your local park isn't very exciting, but visiting a gorgeous national park like Banff in Alberta can spark this fire inside you and inspires you to connect to nature more in any way you can. And the program's effective. Heading outdoors 3 to 4 times a week lowers your likelihood of taking blood pressure pills by 36% and mental health medications by 33%. Living with 10 more trees on your block can also affect your health perception, similar to making $10,000 more per year and being 7 years younger. In addition to PaRx Canada, we've partnered with botanical gardens, conservatories, nature museums, and mobility organizations like Lime. It's an e-bike share program to literally help get patients to nature because transportation is a barrier. Improving access to nature through these partnerships has changed people's lives for the better. I hear it all the time. And as discussed, by connecting people to nature for their health, we're building support for parks, trails, and the planet. For our success, the PaRx program has been featured by the World Health Organization as an effective way to inspire protection and restoration of nature for our health. It won a Jewel Innovation Prize from the Canadian Medical Association in 2021. And we've been named a key partner on 2 international trials focused on introducing nature prescriptions to other countries around the world. And none of this would have been possible without people like you here in this webinar, willing to learn about something new and to start prioritizing a nature habit in your practice. Okay, I do have a short video. It's about 3 minutes. I hope it works. If it's going terrible, someone let me know and I can just send the link.
About a year ago now, I was in talking to my doctor and I just said, I can't shake this depression. He says, I've got just the thing, a prescription for you. I thought, oh, goody, 1 more pill. And he says, no. I want you to spend 2 hours during the week outdoors, minimum 20 minutes each time. And the more I did it, the better I felt. So it all came together way better than any medication I've ever had.
Now, you know, she's 75. So I've got to tell you that I'm 91. So that's why she takes care of it.
I do try.
Nature is everywhere. We can find it in the most unexpected places, and nature is health. PaRx Prescription, or PaRx, is Canada's national nature prescription program. What the physician or nurse does is they sit down with the patient and they figure out what kind of nearby nature is in their community, and then they work with them together to come up with a plan where they can incorporate nature time into their everyday lifestyle.
Some cherry tomatoes. So this is the prescription, and it just gives my name, and it says my outdoor activity plan.
In 2022, we announced a new collaboration with PaRx Canada, where licensed health professionals can now prescribe national discovery passes that give you entry to national parks. There are only 2 national nature prescription programs in the world, and the first one was actually founded right in the US. Cost can be a barrier where there are day use fees. So we're hoping that by prescribing these PaRx Canada discovery passes, that will reduce that barrier to nature access in a significant way. Well, there are 2 major theories as to why nature is so good for our brains. And the first one is called attention restoration theory. When we spend time in busy urban environments, all the hard edges and traffic and lights and people everywhere really make us have to constantly focus our attention to kind of navigate around those obstacles. Whereas when you spend time in nature, it's really this source of soft fascination. So what that does is it restores your powers of attention and it reduces that fatigue and irritability. The second major theory is called stress reduction theory. So basically, when we spend time in nature after stressful events, it helps us be more resilient and recover faster. When I recommended nature for the first time to a patient of mine, I thought he's going to look at me funny and he's going to laugh at me. But he actually just nodded his head and said, you're absolutely right. When I spend more time in nature, I feel better. And so I think healthcare providers sort of have to get over our own mental biases against new sort of lifestyle interventions and prescribe something evidence-based like nature time more often.
50 days from seed to vegetable. I think the prescription helps in that it says, this is a good thing to do. This is worth the effort to do. You need to get out of doors, and it just be surrounded by the greenery and by nature.
I want people to know that nature should be a non-negotiable. The thing about heading outside is that you tend to start to naturally be more active. You'll feel calmer, you'll feel less depressed, less anxious. I think it's just a great way to deal with the stresses of modern life.
Okay, so let's talk about how you can get involved. For people in this webinar or watching it later, you yourself spend at least 2 hours in nature each week, at least 20 minutes at a time for your own health. Get specific, make a plan. At my office, we now take our meetings outside whenever everyone is in person. And I've implemented a snowy walk every year at Christmas with my family. Make nature time a social norm in your circles. If you are a licensed healthcare provider or will be, register for PaRx and start prescribing it in your practice. Spread the word to your colleagues, your friends, your family, and other health professionals. The QR code on the screen gives you the link to register, but you can also find it on our website. If you know a nature-based organization or venue that would be interested in collaborating, please connect us because we're always looking for new partners and more ways to reduce barriers to nature access. You can also always email us at parx@bcparksfoundation.ca. That'll be on the next slide. If you have any questions, to share ideas, or just to say hi. At the BC Parks Foundation, we like to say, by enjoying our time outside now, we can protect it forever. Thank you so much for listening, and I'd love to answer any questions or just to talk about your own experiences with nature.
Laura, thank you so much for that wonderful presentation. I personally learned a lot, and it's so exciting for me as a future healthcare practitioner to see all the very tangible effects that interaction and engagement with nature can have on people's health. So I just wanted to say thank you very much. And I invite anyone who has questions, feel free to put it in the chat, or if you're comfortable to unmute and ask Laura. We just have a couple minutes here, but would definitely appreciate hearing from the audience.
Is it okay if I speak, Laura? It's Barb Astle. Yeah. So I'm a professor of nursing at Trinity Western University, and I have a fantastic group of students that are at Trinity. But I've been, I know Melissa Lamb well, and I work in Planetary Health. So I introduced the PaRx prescription to our students in our Planetary Global Health course probably 2 or 3 years ago. And so they know about it. And if I don't get Melissa to speak, I'm going to get you next time. He's a good friend of mine, but I'm going to get you now. So they are aware of this. And when I tell them that I can, it's about this program. And then when we had our Planetary Health Conference, which I co-hosted with the Faculty of Natural and Applied Sciences, I also then introduced it then. I said, let's have a PaRx prescription. And some of them, Jeffrey heard me speak about that at the conference. And so the reason I bring that up is that it is just exactly, you did a fantastic job of explaining it. And I, as someone that grew up in Alberta hiking since I was very young, and some people know I've been on a lot of extended hikes. I love the outdoors, but it really does something. And whenever I have a conundrum, I tell the students, even when I'm working and I can't figure something out, even at work, because we can get stuck in our chairs there, I go for a walk, even if it's only 10 minutes. It clears my head and I start looking at things differently. So I just want to commend you for this webinar. And I was hoping that we'd have even more students here, but I'm glad to see the students that we do have here. And we have a great champion in Jeffrey. Thank you for co-hosting this, and Nolan for taking notes, because we also do the Planetary Health report card. And this is one mechanism that we can share. But I just want to say that at Trinity in our nursing, because nurses can prescribe this, they've been learning about that, but they don't usually learn about it until second year, or if they attended our conference. But you, as some of medical students, nursing, whoever else is here, it really is a fantastic initiative. And like you said, Laura, getting global reach. Thanks again.
Oh, thank you so much. I'm so excited you're here. I do understand it, it's late and my turnout might be smaller, but hopefully lots more folks will watch the recording. And please, send me an email if there's ever opportunity to help spread the word about PaRx. That's my job. So I'm happy to do it. And I 100% agree, just the difference it can make stepping outside. I was talking to someone recently and they said that's what their grandma always said, and it was kind of like this old-fashioned thing, and we've gotten away from that, but it's so true. If you're feeling angry or you're sad or you're bored, whatever it is, get outside, take a walk, and it feels so good. Thank you so much for that comment.
Yeah, if you have any other questions for Laura, feel free to just say it out loud if you don't mind, or you can put it in the Slido here by scanning the QR code.
Yeah, actually, I had a question about one of the ways of prescribing for the patients, and it was that we could put like even like a nature like a background or a video or a show on the TV, and I'm just wondering how would that actually have the benefits that it does, or at least amount to a little bit of the benefits um to being in nature, and what kind of effect that has and how that was considered as one of the ways. Yeah.
Yeah, great question. And the answer is it won't do everything that being surrounded by nature does and being very connected to nature. I gave that example of you can watch Netflix in the woods and it would still give you a little bit because you would be breathing in the phytoncides, you would be breathing in that air. There would be health benefits, but you're not getting as many if you're, meaningfully connect to it. So in terms of the, picture of nature or putting on a nature documentary. So this is more on the mental health side of things, but it can help you feel calm and de-stress. There's one study they did, and they had patients in a waiting room before a surgery. And one of the waiting rooms had a picture of nature, one had a blank wall, and one had an abstract picture. And the folks who were in the waiting room with the nature, they reported being less stressed, they had lower pain scores, and they were discharged from the hospital earlier compared to the ones with the blank wall. Interesting, the abstract picture actually increased stress. It was not calming in the waiting room. So just like that, I encourage you. I gave a presentation like this to my colleagues at work and shared a nature playlist, and a lot of my coworkers now listen to a nature playlist while working instead of the radio or instead of music. So hope that answers your question. In short, it won't give everything, but it will do a little something. One really great thing I see people implementing, some of our healthcare providers implementing, is greening waiting rooms, or just adding more green if they're in a hospital setting, for example, or a primary care setting, doing murals and, living walls, and just so many great ideas to get more nature into where people are. Love to see them get out to nature, but let's bring nature in too.
Just going to read out some questions from Slido as well. Would PaRx also consider expanding access to park passes for link workers and other people who are not a registered, a regulated healthcare professional, like neighborhood houses and senior resource centers?
Yeah. So in short, the answer to would we include link workers in the program? Absolutely. We've started where we are with the regulated healthcare providers just to work through those existing systems. Link workers and social prescribing is very new. It's not everywhere, but we would love to include them. Yes, maybe I'll stop there.
Yeah, no, that's great. I think even the regulated health professionals, I think in BC there's like 20, that's like 20 something professions, or like 10 more, I think. Okay, and what is the research landscape looking like in terms of new evidence to support these kinds of nature-based healthcare interventions? Is PaRx involved in any projects here in BC or Canada-wide?
Yeah, so there is a ton of research, and what I really love to see and what's really interesting is the research has really gone from this mostly correlative studies, long cohort, longitudinal studies, where it's looking at folks who grew up around nature or go to schools with more nature and then making those associations, which is great. And it's given us a lot of the basis, but a lot of the research now is actually specifically on nature prescriptions, what the effect on those people have had when they've been recommended nature. And then even going further than that, if they're just recommended nature, or if they're recommended nature and connected to a community group, and they're given this other resource, and what the difference is between those groups, basically what is the optimal nature prescription program. And that's the type of research that PaRx is involved in. We're involved in one, currently I've mentioned the 2 international, one's in Australia and one's in Europe. And both of them are focused on nature prescriptions specifically. And I think it's really interesting, that shift of where research is going. Maybe I'll also just shout out, there's such fabulous research going on everywhere. A lot of that phytoncide research was done in Japan, and it's now being replicated here in BC, looking at the trees that we have and what phytoncides are produced. And I think that's really cool.
Wow. Okay. Thank you so much, everyone, for joining us tonight. If there are no additional questions, I think we'll just wrap up. Okay, yeah, thanks again, everyone, for joining so late. It's almost 9 for us in BC, I think for others even later. So thank you again, and just thank you, Laura, for taking the time to share your knowledge with us tonight and just such valuable insights on nature prescriptions. Yeah, also thank you, Andrea, for co-hosting this event with me, as well as the rest of the CSPSC team. Nolan, sorry to see you here. Okay, before we wrap up, just want to remind everyone to check out the resources shared during the presentation. I think, Laura, I'll connect with you so I can send it to all the attendees. And yeah, feel free to reach out to us at cspsctw@gmail.com if you have any other questions. I think Laura will also share her email. And then, yeah, if you'd like to get involved in our upcoming events, or just whether you're here to learn, collaborate, or share this knowledge in your own communities. Thanks again, and we hope to see you soon.
Thank you.
Thank you. Well done.
Thanks for coming. Thank you so much.
We'll be
Have a
in
great
touch.
night, everyone.
Thanks, Jeffrey, Andrea, Laura. Thank you. Nolan, everyone.